welcome to Kauai Health's Community Engagement webinar. My name is Deborah Volison, and I am the Director of Community Engagement here at Kauai Health. And it's a gloomy, rainy day, but we are so glad that you're on with us. Hopefully some of you are snuggled up on the couch drinking coffee, watching this webinar, but the rest of us are in offices and walking to and from different offices. And Gary, I'm glad you could come over on this wet, rainy day. Is it still raining outside?
It's actually kind of nice. The sun's broken through, and
okay.
And today will be nothing but sunshine in this room.
In this room,
yeah,
yay!
Just hinting a little bit.
Well, that's good.
Yeah.
That makes me really excited to jump in. But before we jump in, I hope you're more prepared for Christmas than I am, because I'm starting to stress a little bit.
Thankfully, I have a wonderful, wonderful wife. And she makes Christmas so easy for me. She takes care of all the gifts for family and children, and I only have to take care of her. And as we were talking earlier, I am horrible at that.
Well, as the CEO, shouldn't you have like a personal shopper or something?
No. Maybe if you're some corporate jet setter CEO, but not here.
Not here at Kauai Health. Well,
but like I do often for these telecasts, I will be sliding into Christmas at the last minute, panting finally holding a gift that I just got. So
with a lot of thought
yes.
put into it, I'm sure. Well, if you have sunshine to share, let's jump into that. So let's start with the numbers.
Start with the numbers.
Yeah.
Okay, yeah, that's where the sun shines the brightest. So in terms of the number of positive COVID inpatients that we have today, we are all the way down to 41. So this is the lowest level that we have been since the onset of the Delta variant when it arrived back in early August. You may recall that at the peak of the Delta variant, we had 130 COVID positive patients in-house, and we stayed at that level for a very long time. There was a period of time that we were ranked number one in the state. Out of 490 hospitals, we had the most number of COVID inpatients at Kauai Health Medical Center. So down to 41, so that's great. All adults, we actually had a child in the hospital yesterday with COVID, but he's been discharged, and no COVID patients holding in the ED. So that's my sunniest news of the day. But we do remain a very, very busy hospital. But there's been some relief that's been seen, particularly in the critical care areas. So we are seeing some beds, more beds available in the ICU and the ICCU. But it's still kind of tight on the med-surg side. So I think I'm jumping ahead a bit of myself. So information that you've also wanted to know is, of all those COVID inpatients, how many are in the ICU, how many are on ventilators. So of those 41 that are in the hospital today, only 9 of them are in the ICU, and only 6 of them are ventilated at this point in time. So again, that's very good news. And as of this morning, we have a 21-bed medical ICU. We actually had 5 beds open on that unit, and then we have a 20-bed cardiac ICU. A little tighter there. We only had 2 beds open. Since the beginning of the pandemic, we've now had 1,629 of our employees and 39 of our providers that have contracted the virus. But we currently, as of Monday, we only have 22 of our employees that are still out on a COVID leave of absence. We have no providers that are out. So that's also very positive news, that almost our entire workforce that had contracted COVID over these almost last 2 years are back to work, and we're very pleased to see that. I did mention that we still are very, very busy, even though our COVID numbers are down. So we have 344 adult acute inpatient beds in the Kauai Health Medical Center downtown here. And that includes our 12-bed pediatric unit that we have been using as an adult overflow unit for pretty much this entire year. So Of those 344 adult beds, 318 of them were occupied. So that occupancy rate actually is finally below 100%, down to 92.4%. But also this morning, we had 25 patients that were in the emergency department. They had been admitted by a physician, but they were waiting for a bed to open up upstairs. So when you count those that are already upstairs in a bed and those that are in the ED waiting for a bed, we are at 99.7% occupancy.
Wow.
Which I know that rounds to 100, but over the course of the last several months, it's been quite common that we're at 105, 110% occupancy. So even to dip just a fraction below 100 kind of feels good.
Feels good, yeah.
Feels like you got a little bit of elbow room.
Right.
And then our overall vaccination rate among our employees and physicians remains pretty unchanged. 82% of our employees are fully vaccinated, and 98% of our medical staff. We do have a lot of employees and medical staff members that are getting that third shot, Pfizer or Moderna, that booster shot. And that's pretty much the activity that we're seeing from a vaccination standpoint throughout the county. We're still hovering as a county around 46, 48%. That number, unfortunately, is stubbornly, staying right there. But there is a lot of booster activity going on. But again, that's the already vaccinated people that are getting their booster rather than new people that haven't been previously vaccinated getting vaccinated.
Are we hearing any more from President Biden's mandate that it was going to be required for healthcare workers with no exceptions? Are we hearing more about that?
Yeah, we are. So President Biden, I guess I'd call it an executive order, very similar to the executive orders that come out of Governor Newsom's office. He had put in place that any healthcare entity that received Medicare or Medicaid funds, which is pretty much every single hospital across the entire country, that all of their healthcare workers had to be fully vaccinated by January 4th. So that, we got our flyback.
I guess I didn't kill it.
So that mandate was challenged in federal court, and I don't know which court it was, but the judge imposed an injunction against moving forward with that executive order, and so it is currently enjoined. And so as a result, interesting, I just read yesterday that a number of major hospital institutions, systems across the country, like the Cleveland Clinic, HCA, Intermountain Health, they've all now suspended their mandatory vaccination requirements. So they are now allowing their employees to not be vaccinated and to not have to submit a religious or medical exemption to not be vaccinated. But if you're not vaccinated, you do have to agree to frequent testing, COVID testing, and wear all the protective, personal protective equipment and so forth. So that was a rather interesting movement. Now, it really doesn't affect California hospitals because independent of the Biden administration, Governor Newsom back in July issued an executive order that all California healthcare workers had to be fully vaccinated unless they submitted a declination, which we've had about 1,000 of our 5,100 employees have submitted declinations, but they're undergoing twice a week testing. So we're still following that in California.
So state trumps federal?
Yes.
Okay.
Yeah, but I'm certain the California rule or executive order has been challenged as well, but I have not heard that it's been suspended in any way.
Okay. All right, so our numbers are going down, and we're asked often about our visitor policy. So is that going to loosen up now that our numbers are going down?
Yeah, that's the plan. So, since the beginning of the pandemic, the visitation policy has been very fluid. and we are continuously meeting on it and evaluating it in light of the changing conditions that we're experiencing. So while we continue to be a very, very busy hospital at pretty much 100% occupancy, because our COVID numbers have been going down, we just met earlier this week to talk about, is this an opportunity for us to kind of loosen things up? So effective December 21st, which I think is that Monday of next week, with respect to non-COVID patients, so they're in the hospital for something other than COVID, they don't have COVID, they're not in isolation. Our current visitation policy has been that they can only have one unique visitor. Where are my flycatchers? You can only have one unique visitor for the entire stay. So if a patient stayed 5 days, they would designate who their visitor is, and that visitor could visit every single day throughout their stay, but it'd be that same visitor. So we are going to change that to being a unique visitor per day. So again, that same 5-day stay, it could be, your spouse on day 1, it could be your child on day 2, a good friend on day 3, but it's that friend on day 3 is the only person visiting on that day 3. So at this time, we're really not prepared to have multiple visitors come in and out to the same patient all day long. So, but we'll continue to evaluate that.
So if it's unique, every unique person, though, has to show proof of a negative test or vaccination, correct?
Yes. So that is still in place. And again, that was a governor's executive order. So that went into place in late July, that to visit, you have to show proof of vaccination or a negative COVID test taken within 72 hours of your visit. And you must wear a surgical mask in the hospital. So yes.
Not a cloth mask? Not
a cloth mask. Right. At least, well, that's my understanding. Daniel's shaking his head. It might just be surgical masks for employees, and perhaps visitors are allowed to wear a cloth mask. Gosh, sorry, I'm not clear on that one. But
I prefer the cloth mask. That's why I'm asking.
Is that right? Yeah. I like the surgical mask. It's more lightweight and breathable from my standpoint. I think the cloth masks are more difficult to breathe through and harder to hear people, harder to understand them. Not harder to hear, harder to understand.
Our ears are affected when we wear masks. I get that totally.
Okay.
Well, since we're talking about masking.
Yes.
So the indoor
let me finish on. So
okay.
COVID patients. So we're also, so if a patient is COVID positive and is in isolation, we currently don't allow routine visitation. We do allow visitation under our exceptions, like the patient is nearing end of life, or they've had major surgery that is life-threatening surgery, or they may have a cognitive condition that makes it difficult or impossible to communicate, and so we need somebody there at the bedside. So we've always been able to make those exceptions. And so we've generally made those exceptions for non-COVID, but we will also make all those exceptions for COVID patients as well. In addition, if a COVID patient is experiencing a change in the level of their care, so if they came in and they first were admitted to 2 South, but their condition is deteriorated and they're going to be transferred to ICCU or to the ICU, then the staff will contact the family member and allow a visitor to be present during that transition, that transfer, to help the patient understand what's going on and everything, and be able to maybe reduce the anxiety and so forth. So, so we'll be doing that. In addition, if unfortunately that COVID patient is entering that final stage of life, that end of life, then we will allow up to 4 visitors during that period of time, only 2 at the bedside at each time. So, but we can designate, a family can designate these 4 people will be the visitors for our loved one as they're in this end of life stage. And so you could have 2 that could be at the bedside at all times. And so, and I believe it could be 2 different ones in the morning, 2 different ones in the evening, because obviously we don't know how quickly that end of life stage will occur.
Yeah, we can't discount the importance of visitors. And it's,
No.
you know, it's that, to me, that's been the hardest. I mean, there are a lot of things that have been hard about this pandemic, but not allowing visitors has been really hard.
Absolutely. And yeah, and sometimes, you know, I know folks feel that maybe we're being uncaring, and but believe me, it tears us up as much as it does the family member, because we know how important the healing process and communication, and it's been tough on our nurses and our doctors. They absolutely want visitors. Again, that they're part of the care team, particularly when people, you know, they're scared and anxious, and that's when you most want visitors. Some of it has, you know, those limitations have been dictated by the state and the California Department of Public Health, but largely it's to protect, you know, our staff, our doctors, other patients, even the family members that are visiting from contracting COVID and potentially spreading it. When we adopted these visitation changes yesterday, we went on to the websites of many different hospitals in California, and they continue to be very restrictive. There are hospitals that literally allow no visitors for a COVID patient, even when they're at end of life. And so we're probably, I don't know if we're right in the middle of being very restrictive to being loose, but you know, we're gonna lean and err towards compassion and more open visitation. So if our numbers continue to go down, because yesterday we were really saying, well, maybe for non-COVID we should increase it to 2 at the bedside, 2 visitors at the bedside. And so we were, you know, right on the cusp of that, but when we're at 100% occupancy, you know, we kind of need to see that number, you know, kind of drop a little bit before we're ready to do that.
And there are a lot of people that are weighing in on that decision.
Oh, yeah.
So there's a whole committee.
Absolutely, yeah. And it's doctors and nurses and administrators, and again, they have a bias towards compassion. I can assure you of that.
Yeah. So we were talking a few minutes ago about the masking. And so indoor masking started all over California yesterday. And the question was, how does this impact the hospital? And how does this impact Lifestyle Center?
Right. So from the hospital standpoint, it has no impact whatsoever, because as I mentioned, the governor came out with the first in the nation only. California was the first state in the nation to adopt mandatory vaccination as well as mandatory masking for all healthcare workers, and that went into place in July and August. The masking in July, and then we had to have everybody vaccinated by September 30th or have that declination in, and we were the only state that had adopted that. Since then, there have been a number of other states, and then you had the Biden administration mandate, which has been suspended. So we, as healthcare workers throughout the Kauai Health Organization, we have to wear masks at all times when we're indoors, whether we're vaccinated or not. And we have to wear surgical masks, and those that are taking care of patients on the floors, they're wearing N95 masks and shields and gloves and gowns and everything. So that's been our life since July. So this statewide mandate that now affects you know, every business. Although interestingly, I heard that the city of San Francisco has been uniquely exempted from this. I don't know if it's because their vaccination rate is so high, but I haven't learned enough about it to really understand that, but I heard that last night on the news. And they do have a very high vaccination rate, and we have a low vaccination rate here. So, so short answer, it doesn't affect the hospital at all. However, it does affect the lifestyle center. Which, again, in San Francisco, their gyms are exempt, but ours are not here in Visalia or Tulare County. So yesterday, we did change or modify our mask wearing requirement. And so all members, all guests, all people coming into the Lifestyle Center have to come in wearing a mask. And you have to wear that mask throughout your entire time that you're in the Lifestyle Center, unless you're exercising in an aerobic fashion. So running or walking on the treadmill, the gauntlet, the bike, things where you're really exerting yourself from a respiratory standpoint, then you're permitted to take your mask off during that. But if you're weightlifting, which is anaerobic, although it can still be very intense, you have to wear your mask while you're doing exercises on the weights and other equipment. You certainly, if you're down in the Mosh, is that how it's pronounced?
Mosh.
The Mosh Cafe downstairs, certainly while you're eating or drinking, you can remove your mask as well. So, and we got a little bit of angst yesterday. There definitely was some resentment, and Jag Bath kind of did some research. What are other gyms doing throughout the county and the community, and it's all over the board. Planet Fitness is, I guess they're really on the strict end. They require a mask at all times, even if you're aerobically training, where others aren't going to enforce it at all. We're trying to kind of reach that medium. It goes into effect, or it's in effect and only until January 15th, so hopefully we can just kind of grin and bear it until then. And
hey, this might be a huge weight loss motivator. If somebody is against wearing a mask, they just need to go in the gym and run
the
for
whole
like
time
an
they're
hour,
there.
and they don't have to wear their
You always
mask.
find a bright spot in it, Deborah. That's
I hate
great.
masks.
That's great.
And Laura Flores just texted and said those new visitor guidelines go
Yes.
into effect on Tuesday.
Is that the 21st?
Yes.
Oh, okay.
Yeah. So you were right
I
on the
knew it
date.
was
She
the
just wanted
21st.
to
I didn't
pinpoint the
have-
name
yeah.
or the day.
Like-
Okay. Well, maybe we'll get some weight loss out of that. So thank you, Gary. And I'm going to put in a shameless plug here. The Mosh Cafe is delicious.
It is. Yes.
It is really good.
Very
and we've had her cater a few of our meetings, and it's fabulous. Okay, so let's talk financials.
Okay.
So everybody on this call, they've been with us for a long time. They know it's been up and down. We've had a lot of downs.
It's been
in
mostly
the last,
down.
Mostly
Yeah,
downs.
it's hard to remember an up.
Yeah.
But yeah,
so
mostly been down.
Is this part of your sunshine?
It is.
How was November?
It is. The sun's shining bright. So we've heard of the Miracle March. I'm going to call this was Miracle November from a financial standpoint. So with the fact that we're really busy, running 105, 110% occupancy in the acute medical center, our net patient revenue, so the revenue we generate from Medicare and Medi-Cal and commercial insurance companies came in at $54.8 million for the month, which was about $2 million, almost 4% higher than budget. But our operating expenses, they came in at $70.1 million, which was almost $3 million, almost 4.5% higher than budget. So you're probably going, well, Gary, I don't get it. 50-something million in revenue and 70 million expenses. How could it be a good month? Well, there's another category of revenue that we call other operating revenue. So it doesn't come directly, related to taking care. It's related to taking care of patients, but it's really the vast majority of it is supplemental funding that comes from the federal government for taking care of a disproportionately high number of Medi-Cal patients. So you've heard me say often that Tulare County has the most number of Medi-Cal beneficiaries of any county in California. So literally 61% of everybody living in Tulare County is enrolled in the Medi-Cal program. So a lot of poverty. So the federal government, through these supplemental programs, intergovernmental transfers, what they call rate range adjustments, public hospitals in California, and that includes county hospitals, the University of California hospitals, and district hospitals like Kauai Health. We get to participate uniquely in those supplemental programs because we tend to take care of a higher number of Medi-Cal patients. So because of that, our other operating revenue came in at $22.2 million, which was about $7 million higher than budget. So that had a very, very positive impact. And we also received about $6.5 million in federal stimulus funds in the month of December. So the vast majority of it, about 5.8 million of it, came from the American Rescue Plan. That was signed into law by President Biden back in March of 2021. And it had a pool of roughly $8.5 billion that was set aside for providers who take care, again, of a disproportionate number of patients that live in more rural communities. So they looked at this time period, about a 12-month period, and this was both physicians and hospitals, and based it on the number of Medicare, Medi-Cal, and Children's Health Insurance Program patients that live in rural communities. And so we got 5.8 million of that. And so when you have really high patient revenue, you have high federal supplemental funds and these stimulus, COVID stimulus funds that came in, we actually ended up with a positive operating margin of about $13 million for the month. So again, that was a rainmaker, a miracle maker. So we're now 5 months into the fiscal year that started July 1st. So the 5 months from July 1st, 2021 to November 30th, 2021, our operating margin, if you excluded those federal stimulus funds, we'd still have a loss of 2.8 million. So we'd still be in the red. But now when you add in all the federal stimulus funds that we've received, we now actually have a positive operating margin of 4.3 million. So we're in the black. And that 4.3 million is about $173,000 higher than budget. So we're pretty much right on budget is what I would say then. So a lot of celebration this week among our executive team, and I know our board is going to be thrilled to hear this Monday night. And we've also been informed that in fact, I might have even known the number as early as today. We might not hear till maybe tomorrow. But then there is $9 billion that's still in the Provider Relief Fund, which is part of the CARES Act that was signed into law back in March of 2020 by then President Trump. And so that $9 billion is now being released, what they're calling Phase 4. And we don't know how much we're going to get of that, but we're likely to receive it by the end of this year. And so we'll be able to record that in the month of December. And so December could also be a very positive month. And what a great way to start the new year.
Okay, so an event happened last weekend, and we received a lot of inquiries about that. So we had a flood in our emergency department.
Yes.
And the question everybody really wanted to know was that flood in the new part of the ED? And then what was the cause? So everybody was worried that it was our new expansion.
We had our own atmospheric river in the emergency department back on Sunday, December 5th. So before the storms hit us, earlier this week on Tuesday, we had our own internal storm, one that was very, unlike us who pray for rain, you don't want it to rain inside of your hospital. That's not a good thing. So we pray for drought inside the hospital. But yeah, so in zone 2, so we have 6 zones that make up the entire emergency department. And zones 1, 2, and 3 are in the old part of the emergency department, kind of the original emergency department. And then zones 4, 5, and 6 are the newest zones that have been constructed over the last couple of years. Zone 5 being the newest, the 24-bed expansion out in the east parking lot. So a fire sprinkler head in the ceiling of the hallway, the main hallway in zone 2, just suddenly popped off. Nobody touched it, nobody tampered with it. It just suddenly around 6 o'clock Sunday evening just popped off. And literally tens of thousands of gallons of water in all the pipes that go up 4 stories just came gushing through that sprinkler head. And so it flooded zone 2 and 3 of the emergency department. So our staff are so incredible, our maintenance crew, the fire department was incredible. Quickly sealed it off, rerouted, moved patients. It took 17 beds out of order, but we still managed. I think maybe went on diversion for just a very short period of time as we made the logistical changes, but that was quickly taken care of. And then we brought in Service Master, thank you Tony Benevento, always quick to come to our aid when we needed it. And so they've been working diligently along with our staff, and we cleaned it all out. We replaced sheetrock and flooring, and so I think it was Tuesday night that we got the all clear sign and started seeing patients again. So we're back into business, and yeah, it was quite an experience. We did have a few of our staff that got a unexpected shower during their shift.
Was it in a patient room?
No, it was right in the hallway where the ambulance gurneys normally, line up. There was a gentleman that had just been intubated outside the room that it was gushing into, but we were able to move him up to the ICU quickly. And then again, it was right outside the place where the registration staff work, and we did understand they got showered on. And so we also ended up replacing a lot of shoes of our staff and our physicians that were sloshing around in 2 to 3 inches of water, helping move equipment, and their shoes didn't fare so well, so we've replaced those. So,
Wow. COVID,
quite
variants, floods.
When's the locust coming? That's what we were joking about. So.
Okay, so antigen testing. Where can a community member go to get that, and how much does it cost?
Okay, so remember, just to remind folks, there's the PCR molecular test, and then there's the antigen test. So the PCR molecular testing can only occur here at the hospital in our laboratory. But the antigen testing is available in many, many different areas throughout the community. So you can get an antigen test at any of our 5 rural health clinics in Exeter and Lindsay and Woodlake, Dinuba, Tulare, or at either of our urgent care centers on Court Street or Demaree, and simply go on to our website and you'll see the clockwise link there. And so that's the scheduling system for a COVID test. Different than the MyTurn platform, which is for a COVID vaccination. So you go on that clockwise platform and you see all the different sites and appointments that are available for a test, and so you schedule yourself for that test. I realize there's still a lot of testing going on, it doesn't mean one's going to be immediately available, but there's quite a bit, again, of capacity there. And then you will be contacted by a provider. You'll have a quick telehealth visit just to screen you and see what's going on. And then you'll come in to be swabbed, and they will run it on the Sophia 2, instant read platform, and usually you get your results back within an hour or two. So you can do that now. If you're covered by Medicare or Medi-Cal or commercial insurance, we will bill your insurance company. You may have to pay, a small copay, a $20 or $30 copay, depending on your insurance. If you don't have insurance, it's generally fully free. My wife, I know, got a couple. When I had COVID, she went twice to our Tulare clinic to get her COVID test. She had the telehealth visit. They submitted a claim to our Kauai Health Insurance, and I think there might have been a $20 copay, but maybe there wasn't. But it is a pretty nominal amount. Now, I've been asked by some friends and people in the community, particularly those that are flying during the holidays. Gary, I need a PCR test. So a lot of the airlines or countries that you might be flying into actually require a PCR test. They won't accept an antigen test. And so you can get a PCR test, and what you need to do is contact your primary care physician, have them write you a lab order to have a COVID PCR test performed, and then you bring that to the Kauai Health Medical Center. You walk into the Mineral King Wing entrance, and right across the entryway is our new outpatient lab draw station. And you present that lab order to them just like you were going there to have blood drawn, or for your annual physical or whatever. And they will they'll swab you and then run the PCR tests downstairs on our PerkinElmer platform. You should come early in the morning if you want to get your results that same day, because we batch all of those samples and run them just a few times a day, but you'll get your results back that same day.
Okay, thank you.
And I did read the mask mandate that did go in effect yesterday. One of the things I read also is that, kind of reverting back to a previous mandate, anyone attending an outdoor event with more than 1,000 people attending now has to provide proof of vaccination or proof of a negative test taken within 24 hours of the event. So it used to be generally 72 hours. Now it's 24 hours. It didn't say whether it had to be PCR or antigen. And I don't know how strictly it's going to be enforced. I'm actually going to the 49er game on Sunday. So I will see how it's going to be enforced.
So you would have to take your test then on Saturday?
Well, I have my vaccination, so I can show proof of vaccination, but yeah, I'd have to have it done on Saturday, a 1:05 game. So does that mean I have to have it done between 1:05 on Saturday and 1:05 on Sunday? So it's going to be really interesting to see how this is enforced. And even though it's the San Francisco 49ers, they're not in San Francisco. They're in Santa Clara, so we're not exempt from the mask mandates. So, yeah.
Okay, so a question came in. Is the Tulare County Lab currently testing for the new Omicron variant? And if so, have we reported positives?
I believe they are. So they're able to do the whole genome sequencing. As I shared with you in the past, we don't do the genome testing here, but we send all of our positive samples, not knowing what they are, to the Tulare County lab, and they then sequence them. They're the ones that reported back to us that 99% of the samples we had been sending were Delta, the Delta variant. So we're still continuing to send them. I have not heard that any of them have come back with Omicron as the variant. So, but I need to check in with Randy Coca today to see if that's changed. But it still looked like we were just experiencing the Delta variant.
Okay. So the question is, what is the current standard of care for patients in the ICU, and how long have we used this protocol?
Okay, so I went to the expert, Dr. Joseph Malley. Dr. Malley is a critical care intensivist. He's a pulmonologist, but he's also the medical director of critical care services here at Kauai Health. And so I'd sent him an email, and he said, Gary, it's incredibly difficult to provide an answer back in, email, because it really depends. There are so many factors, so many variables that really influence the care, the protocols that we might apply. I will say first and foremost, since it's a respiratory condition, they treat it as an acute respiratory distress syndrome case. And so there is a protocol for ARDS. This is SARS, which is ARDS, so SARS stands for Severe Acute Respiratory Syndrome. So first and foremost, they're trying to make certain that they're providing safe oxygen support. And so that comes in various forms. So it starts out that you're on a nasal cannula, where you have the little plastic tube and little probing into your nose, and it's hooked to a tank, so many liters of oxygen, so the amount of oxygen and pressure that's coming in. And that's generally how we support initially somebody that has a low oxygen saturation level. But then it could move to CPAP or BiPAP. So BiPAP is bi-level positive airway pressure. So it is a ventilator that is placed on the patient. It's not very comfortable, and a lot of patients don't tolerate it very well. So you can have that bi-level, or you can use CPAP, which is the continuous pressure. A CPAP is people with sleep apnea that need that continuous pressure to keep their airways open. They have an at-home CPAP machine. So we will use both either CPAP or BiPAP as the next level of oxygen support past that nasal cannula. The next level of oxygen support is full ventilation. So that generally occurs in the ICU, although we have intubated patients outside the ICU, and so that's where they place a tube into your windpipe, and it's hooked up to a mechanical ventilator, and it is essentially breathing for you. Those other forms of ventilation are complementing your own breathing. You're still breathing on your own, but it's giving you a boost. It's kind of supporting you. If you're intubated and you're on a full ventilator, you're now sedated pretty heavily with propofol and other sedation medications, so that you don't pull out the tube, and you don't have, which is, I would imagine, it's extreme agitation. I can't imagine being fully alert and being ventilated. So, so that oxygen management is the most critical. But then we also provide steroids, which are anti-inflammatory medications. So COVID can produce a very inflammatory response in the lungs. And so by providing steroids, that can help treat that. And then also medications like remdesivir, and most recently baricitinib are two different medications that are often given in combination with steroids. So that's kind of the protocol, but again, it varies patient by patient. And it's been, I read this every day, and to watch patients move back and forth through medical surgical to ICU or ICCU, they go to ICU, they improve, they come off of the ventilator, they go on to just a nasal cannula, they get transferred back to 2 South, and then for whatever reason they start deteriorating and they go back again. So our physicians have had to be very flexible. There's also, patients that have certain comorbidities, rheumatoid arthritis in particular. So we've seen that a lot where patients with rheumatoid arthritis, which means they're already immunocompromised, they're already on steroids, the options for them, you're not giving them remdesivir, not giving them other steroids because of the effect it could have. So that's why Dr. Malley says it really depends. There's so many factors and variables that there's not, this is what we do for every COVID patient that's in the ICU. It just can't be done that way. But, again, over the entire course of the pandemic, they've learned so much. They've improved so greatly in the treatment. Obviously, new medications have been coming out. We're anxiously awaiting the oral pill from Pfizer and Merck, which is the antiviral. So when you get the flu, we give you Tamiflu, which is an antiviral, and if given soon enough after you have the onset of symptoms, it can be very effective in keeping you from getting severely ill from the flu or being hospitalized. These antiviral COVID medications are expected to do the same. We also patients that have contracted COVID that are still in the outpatient setting and are at higher risk for being, getting severely ill or being hospitalized, we're giving them the RegCov from Regeneron, which is the monoclonal antibody we give subcutaneously through the 4 injections. So just so many things have become more available that it influences the treatment that we provide when patients do end up getting hospitalized.
Yeah, thank you. So the last question, and it's kind of interesting, but do we anticipate an increase in COVID-19 patients after the holiday season? And I'm just going to throw this in here, although I'm not paid for my opinion. It's been really weird to me that we had the surge in September, October, November, crickets from the state, right? Crickets.
Right.
And then our numbers go down and we're getting lower and lower and lower, and now we have a mandate. Where was this mandate in September when we were overwhelmed, and in October?
Yeah.
Okay, that's all. That's all I got to say about that.
Yeah. So, no, you make a great point. So you remember in March, the virus appeared in Tulare County in March of 2020. And we almost closed the hospital down. I mean, we stopped all surgery, and it was a ghost town here. You could go up on the units and people were just sitting around. Everybody's so afraid to go out of their homes and go to the hospital. We really didn't, but we were bracing for that big surge that never came until after the 4th of July. After the few weeks after the 4th of July, we got hit with our big surge. And it lasted for a couple months, and then it simmered down in September and October, and then all of a sudden Thanksgiving occurred. And a few weeks after that, that was the second surge, and we were deep underwater. December and January were really, really tough. So, I think we hit 170 COVID patients. We had another, it died down. We had another mild surge in the spring. It died down. We got all the way to June or July, and we only had 4 COVID patients in-house. And then August, the Delta variant, the 4th surge arrives. We have 130 patients, and it simmered down. But you're right, there was no mass mandate through that 4th surge, through the Delta variant. But what's happened is with the appearance of Omicron, that has got everybody very anxious because there are indications that Omicron is even more contagious and transmissible than the Delta variant. On the flip side, there's a strong indication that it's far less severe than the Delta variant, that it more is like a cold. They're calling it the Omicron cold because, you're likely to get it, but you'll have cold-like symptoms. You're highly unlikely to end up in the hospital. And but the state and the county has, over the last week or two, experienced a rise in the number of COVID cases that are being reported. It's up like 40-something%. So that's what has triggered the mandate and the concern that we're now entering the holidays, more physical gathering indoors at a time that Omicron, so it's preventative, frankly. But we'll see.
But we're 3 weeks past Thanksgiving.
We are, and yeah, and our COVID numbers continue to drop, but it's really what's dropping is the COVID hospitalizations.
Right.
And so even Tulare County, I looked, they sent out their report yesterday or Tuesday, and the number of cases per 100,000 population is up. It's risen, but they're not ending up being hospitalized. Although, remember that hospitalization is always the last trailing indicator. So you get COVID, you don't end up in the hospital for generally a week, 10 days, 15 days. So the rise in COVID cases is just now occurring. You know, are we going to start seeing an uptick in hospitalizations? We certainly hope not. You know, we hope and pray that this year is going to be so different than last year. And there's every reason to think that. You know, last December and January, the height of the pandemic, we did not have vaccines. We did not have antiviral medications. We did not have monoclonal antibodies. You know, so we have that in our arsenal today. And so that gives me great optimism that it certainly will be much better than last year. I firmly believe that. But we probably will still experience over the winter months maybe an uptick in COVID, but again, nothing to the level that we saw last year.
Okay. Well, thank you. And thank you, Gary, for answering all of the questions. And we have answered everything. And so we want to thank everybody for joining us. And we're going to get off a few minutes early. And maybe you can start shopping for your wife and give her a thoughtful gift. Right, Kathy? Would you like that?
Yeah.
So
don't talk to her. I don't want, yeah. Yeah, this is a secret. She doesn't know that I procrastinate. She thinks I've already gone out and bought all her gifts. So yeah.
Really?
Don't blow my cover.
Yeah. How long have you been married?
38 years.
Okay. Yeah. She doesn't.
She knows
that.
me by now, huh?
So Gary, end it with some inspiration.
Yeah. Again, thank you all for being here today. We really appreciate it, and I think this is our last telecast before Christmas Day. So on behalf of the entire Kauai Health organization and myself, Deborah, Daniel, Maria, we just want to express our deepest heartfelt Merry Christmas and Happy New Year to all of you. I hope you have a safe and wonderful time enjoying your family and friends over this holiday season. I know it's always it's a great time, and I always look forward to it. My wife has turned our house into the North Pole. Although we were experiencing some circuit breakers blowing last couple days because of the rain, I think. All my snowmen and everything out.
Not a Christmas vacation moment where he
all my stuff out in the yard.
Inflatables?
No, they're not inflatables. They're but yeah, they're lights and everything, and you know, you always like Chevy Chase. I got all the cords, you know, all hooked up. And I think all the water, I don't know if just got into the receptacles and clicked it off, but my wife couldn't get out of the garage because it tripped the breaker that opens the garage door, so yeah, she was upset with me. But anyway, sorry, didn't mean to, go off on that tangent, but again, thanks to all of you. Again, we appreciate you staying with us. These 4 years now. It's hard to believe that we actually launched all of our community ambassador groups and our community advisory groups and EDAC and PFAC and everything. It's been 4 years now, and you've stuck with us this entire time, and we're incredibly grateful for that, and we look forward to getting together with you in 2022. So have a great weekend, everyone.
Merry Christmas.